We're currently conducting a review of bureaucracy in the NHS in terms of how we can reduce unnecessary bureaucracy from the system. It's something the Secretary of State has commissioned us to do. It's part of 4 different reviews that came out of Francis, specifically looking at how to improve quality in the NHS. So what we wanted to do was really look at how can we reduce unnecessary bureaucracy in the system, recognising that actually bureaucracy has a place and it is important, but where is it unnecessary and how might we be able to reduce that?
Speaking as a clinician, we've always felt that there's too much paperwork in our worlds, and the staff certainly told us that while we were out and about in the different sites talking to staff.
You need to maximise the amount of time your clinical staff have in providing hands-on care. And therefore an essential part of this is about how we make sure that the data gathering that we do is appropriate and has value and isn't ineffective and inefficient and therefore unnecessarily bureaucratic.
So in March this year, we produced an interim report which made a number of draft recommendations about what we thought would make an improvement in terms of reducing bureaucracy in the NHS. Following that, we wanted to do a much more in-depth piece of work with providers to understand from our members' perspective what the size and nature of that problem was and make sure that those recommendations were the right recommendations. So following that, we've partnered with McKinsey to do some really detailed work with 7 different trusts going across acute mental health and community providers to start to really understand their story and what they think would really make a difference to them in terms of reducing their bureaucracy. We've also done some detailed work with members. We've run a number of events, a webinar, some smaller seminars and roundtables to really make sure that whilst we've been looking at 7 trusts and understanding that that is a snapshot and quite a small sample, that we broaden that out and understand from our broader membership whether we're on the right track and whether the recommendations and findings are really resonating across the system.
We're bringing this whole issue under the spotlight for the whole system, and we're developing, I think, a consciousness that as the system and the new NHS develops, we can't allow the demands for collecting data just to grow out of all control. We've got to have a really rigorous process that looks at value, that looks at systems, and that doesn't overburden the clinical staff.
The review has found that actually bureaucracy is not necessarily all a bad thing. Actually, people, staff and members of the public both told us that they understand why bureaucracy exists and that they understand the importance of it. What we can do is there are still elements that we can reduce, but what we really need to focus on as well is really getting the most value out of that information we're already collecting. If clinicians are telling us that they value and understand why they're collecting that information and the benefits to patients' care, what we need to be able to do in the system is make sure that that information we're collecting can be used and turned around and understood in a way that in a timely way, so that that can feed into making improvements in care.
We found that not only is it problematic for staff, and not only are staff collecting more information, but the bureaucratic processes are often turgid because of the systems that we have in place. So what we know is it's not just about getting the right amount of data and the right quality data collected. It's about changing the systems and the way in which we manage data and information.